If you've ever had a kidney stone, you know you're never going to want to have one again. Let's talk about 3 supplements proven to help prevent and dissolve kidney stones naturally. Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to health and hormones, and welcome to the Wild Wisdom Show. Today we're going to talk about the 3 supplements proven to help dissolve kidney stones and prevent them from coming back again. Now let's talk about why these supplements work. These supplements are nutrients that help by improving the chemistry or the pH, acid-base balance of your urine. They reduce the stone-forming crystals that typically occur in kidney stones, and they protect your kidney from inflammation, which can lead to kidney stones and also aggravate the pain associated with kidney stones when they're present. So let's talk about the first supplement, and that's magnesium. Magnesium is a mineral that has been shown to bind with oxalate in your gut, thereby stopping it from turning into kidney stones later. There are many different kinds of kidney stones, and the most common kind is calcium oxalate, where the oxalate binds with calcium and forms a stone. But when magnesium binds with oxalate, it prevents it from turning into calcium oxalate stones in the future. So this is a great way to prevent the most common kind of calcium oxalate stones. Also, magnesium, once it gets into the body, can reduce urinary oxalates as well. So it'll bind to oxalate in the kidneys and lower the stone risk in the kidneys directly. That also helps prevent any calcium oxalate stones that have formed from clumping together and becoming large and painful. As long as the stones are small, they can be passed through the kidneys into the ureters, into the bladder, and then you pee it out. So anything that will prevent these stones from clumping together will be very helpful from preventing the outcome of kidney stones, which is extreme pain when they get stuck in the kidneys or in the ureters, which are the very thin tubes that connect the kidneys to the bladder. And that's where the pain from kidney stones come from. The typical dose that has been found to be useful for preventing the formation of stones with the use of magnesium or for dissolving stones with the use of magnesium is anywhere between 250 to 500 milligrams a day. And if you're taking 500 milligrams a day, it's ideal to split that dose up. So for example, 250 milligrams in the morning and 250 milligrams in the evening. Magnesium is a very safe supplement, especially at this dose. They even give it to pregnant women when they develop hypertension, or otherwise called preeclampsia during pregnancy, as a treatment for the hypertension. So very effective and safe dose to use for the kidney stones prevention and removal. The next supplement is potassium citrate. And potassium citrate is super interesting because it turns into bicarbonate in your body, which raises your urine pH. It makes your urine less acidic and more alkaline. Now, potassium citrate is also found in things like fruits and vegetables, but when you're taking it as a supplement, you're getting a bigger dose with the purpose of really changing that urine pH towards a more alkaline pH. This helps dissolve the second most common type of stones, which are uric acid stones, and also prevent new ones from forming as well. This also increases urinary citrate, which binds calcium in the urine and prevents calcium from binding with other minerals like oxalate or phosphate to form crystals. Again, calcium crystals are the most common. Calcium oxalate are the most common amongst those. There can be other stones like calcium phosphate. And then the second most common category of stones is the uric acid stones. So the potassium citrate supplement can help with both most common types of stones. The typical dose in research is anywhere between 30 to 60 milliequivalents a day in divided doses. So you wouldn't take this all at once. You would divide it to 2 or 3 times a day. And in studies, this dose did show to reduce stone recurrence and help dissolve small stones. Now, when you buy potassium citrate, it probably won't say the dose in milliequivalents. It'll probably say it in milligrams. And 10 milliequivalents of potassium citrate equals about 1,000 milligrams of potassium citrate. Now, if you have any problems with kidney function, like low creatinine or glomerular filtration rate, which you would have tested with your blood work with your doctor, measuring kidney function, you would definitely want to speak to your doctor or your kidney specialist, a urologist or nephrologist, about taking supplements like this because you want to make sure you're not overdoing the potassium. But if you have really good kidney function, as per these blood tests, potassium is generally considered to be very safe. The third supplement is called Nigella sativa, also known as black cumin or black seed. It's an ancient remedy, but it has really surprising modern evidence showing that it really works. And this one works to fight inflammation, oxidative stress, and supports natural stone passage. There's some research to show that when we have inflammation in the body, we tend to make more things like kidney stones. And so when we can lower inflammation, particularly at the level of the kidneys, we can reduce the formation of kidney stones and help them to pass more easily. Doses used in studies vary anywhere from 500 milligrams twice daily to 1 gram twice daily or even more. But that 500 milligrams to 1,000 milligrams twice daily is the most commonly studied dose. And for example, one study showed that 500 milligrams twice daily for 10 weeks had 44% complete stone expulsion. So about half of the population in that study got rid of their stones completely. At 1 gram twice a day for 2 weeks, the size of stones were halved. So they decrease in size by half, by about 50%. And that's great because when you decrease the stone size, that means that stone can go from being stuck in your kidneys or your ureter to being passed through like going down a water slide out of your body. What's really interesting about these studies is that Nigella sativa had a better stone passage rate, getting rid of the stone, than a very commonly prescribed medication for this called tamsulosin. So this is a really great natural option that's even more effective than a prescription medication in this case. Here's some pro tips as well to make sure that your experience with kidney stones goes by very quickly and with as little pain as possible. Tip number 1 is stay hydrated always. These supplements work best when your urine is diluted, so it should be peeing out a light yellow urine. That's when you know you're drinking enough water to cause these supplements to work well and also improve the passage of those stones by flushing them out of your system. The second tip is that people get concerned about eating calcium in their diet, and research shows that as long as your calcium is with your meals, so you're getting it through your nutrition, it is okay to have the calcium. It is problematic when you're taking calcium supplements in between your meals. And as long as you're getting enough magnesium with your calcium, calcium is not generally a concern. It can become a concern if we have too many oxalates and we have a problem with oxalate buildup, which some people can have, or if we don't have enough magnesium, which allows the calcium to dissolve and not turn into stones. So again, you want to make sure that you are hydrating well, you're getting your magnesium, considering potassium citrate and Nigella sativa. And when you combine all of these things together, they could offer a very powerful kidney protection, natural support backed by science, and your kidneys will thank you. If you enjoyed this episode, please subscribe to my YouTube channel, Dr. Patricia MillsMD. It is the very best way to support the Wild Wisdom Show. Save this episode for future reference and share. Sharing's caring, and you never know when someone might benefit from this wild wisdom. I'll see you next time. Bye now.